Hello everybody, welcome back to my channel, and today we are going to be talking about the IV cannulation. In my last video we talked about IV cannulas, definition, the uses, the contraindication, the indication, the sizes they have. This video we're talking about IV cannulation instead of IV cannula, the procedure, the requirements, purpose of IV cannulation. There will be a demonstration in this video, and hopefully there will be a special guest in this video. So without wasting much time, let's get right into the video. What is this IV cannulation? Intravenous cannulation is a technique in which a cannula is placed or inserted into a peripheral vein in order to provide venous access. Veins have a three-layered wall composed of an internal endothelium surrounded by a thin layer of smooth muscle fiber that is then surrounded by a layer of connective tissue. That means the vein consists of three layers. The inner layer is the internal endothelium. The second layer is the smooth muscle fiber. The outer layer is the connective tissue. In my last video, I said that the best vein to insert an IV cannula is the superficial vein of the upper extremity. And this is why. It's because it interferes less with the patient mobility and it poses less risk for phlebitis, which is the inflammation of the vein or vein inflammation. Anyways, without deviating so much from this topic to cause confusion, note that this IV cannulation is the core clinical skills to know. That means if you don't know any procedure, you should know how to insert a cannula. You should know how to cannulate a patient. I heard that in some hospitals that nurses are not allowed to do this procedure, that it's only doctors that are allowed to do this procedure. Some places nurses can do it, doctors can do it, but whether you can do it or not, just learn it in case of emergency, because there are cases where you cannot be on board and you're the only one there, you have an emergency, you not start waiting for doctors to come and start setting cannula. You have to do it by yourself, right? Yes. Now let's talk about the purpose of IV cannulation. One, as we all know, is administer IV fluids and medication for repeated blood sampling, and then to administer blood and blood products, also for chemotherapy and others. So now the process of IV cannulation. IV cannulation process is divided into 4 different steps, which are an explanation and content, preparation, procedure, and documentation. You can also add aftercare. Now for the explanation, you need to introduce yourself to the patient, tell the patient who you are. Then you confirm the patient's identity, check the wristband, confirm the name, the age, the date of birth of the patient, the hospital number too. Then you describe the procedure that you want to carry out and the importance, that's the rationale behind the procedure you want to carry out. So you explain it to the patient. Then you explain that there are some risks that might take place while doing the procedure. After there can be infections which can be minimized by non-touch aseptic technique, hematoma and vein inflammation. So you need to inform the patient, care them, you just to educate them that this can be a risk. Now let me give a scenario. Hello, Mrs. Joe. So today I'm going to be placing a tiny tube into your vein in order to be able to give your medication straight into your vein. You are going to feel a little scratch, but then it's going to get better. That you have explained it, so you have told your patient what you want to do, right? We talk about the concept. This one, you are getting a verbal consent from a patient to be able to continue. After you have explained the procedure to the patient, you are now going to wait. There are some patients that might refuse the procedure. So how would you say, hey Miss Jones, will it be okay to continue to go ahead with this procedure? Make sure that she's happy to go ahead with the procedure. I don't think if anybody will be happy to allow you to insert the needle, but then for that moment, just make sure that you get the consent from the patient, okay? Then after you gain consent, you now go ahead to prepare the requirement. In this preparation, we talk about the requirement. which involves the equipment they are going to use to carry out the IV cannulation. And now I was able to get a few equipment to show you all, but there are some equipment that I could not get, which I'm going to improvise with some other things. But I'm going to try as much as possible to put the real equipment picture in the screen so that you can know the difference between the provision and the equipment. So let me get my equipment so you can see. So now let's talk about the equipment. The first one to know is the clean procedure tray. The procedure tray. So this is a food tray, but the procedure tray, that's what you need. That's the first step. So you need a non-sterile gloves, because this procedure is not a sterile procedure. It is a clean procedure. So even though it's not a sterile procedure, you need to follow and maintain aseptic non-touch technique. So these are the sterile gloves you need. And then obviously you need a cannula. The cannula, different sizes. You need different sizes of cannula. If the patient vein is a tiny vein, make sure you use. So if you want to know, just go back to my first video and watch the part 1. So yeah, next we have a gallipot containing wet swab, spirit alcohol swab. We have a gallipot. This is an provision. And then we also have a gallipot for dry swab. This is wet swab. This is dry swab. Next we have the collection tube. These are the tubes to collect blood sample. Then we have the plaster. The plaster is also called adhesive tape or plaster. In the case whereby you don't want to administer fluid for 1 hour and you don't want to waste your hospital resources, you can make use of this. This is called scalp vein. Some people call it butterfly. It's called scalp vein. Yeah, so just if you don't want to wait, kind of like, you can just use this. In 1 hour you can remove it. Or there are some people that will just come for IV medication, just one ampoule. You can just use this. Next, the prescribed infusion here, but I don't have any prescribed infusion here, so I'll put a picture for you to see. Then we have the scissors, counter scissors, to cut the tape. Of course, this is on the provision. We have a giving set. We have this giving set to administer prescribed infusion. We have the tourniquet, right? This is tourniquet. But in my country, Nigeria, even though some hospitals have this, they don't make use of this. You know what they make use of? This. But this is this Nigerian tourniquet. I don't know, maybe some other countries use it, but this is what we normally find for tourniquets in the hospital here. You know where they get this thing from? Let me show you. From this. From this. This is where they get it from. This is our tourniquet. Then next we have the water for injection or saline to flush. Then we have 5 ml syringe and 2 ml syringe. Local anesthetic cream, which is optional. You can decide to use it, you can decide not to use it. Apron, which is optional, okay? Then you have splints, which are normally used in children, just like folded carton. They just put the arm in place so that they won't be moving their hand anyhow. And you have to settle line every 5 minutes or 5 hours to get. So we use the splint. We have the receiver for use swab. This is my provision. Receiver for use swab. Normally it needs this. I will put the picture up, don't worry. So this is the receiver for use swab. We have the dressing market touch and towel. Dressing market touch and towel. So this is normally used placed under the patient arm. If you puncture the vein, and then the backflow of blood can be massive, which can stain the bed or the patient's clothes. Use this in provision. We have the extra needle. You must always have an extra needle around. Yes, you need it. Then we have the safety box in provision. It's actually bigger than this, but yeah, something like this. Safety box to store sharps or needles or broken bottles. You use safety box. Lastly, the vein finder. I do not have vein finder. I don't know how to improvise with the vein finder. Can use a torchlight if you don't have vein finder. That's all about the requirement. Before the procedure, make sure that the room is warm enough to encourage vasodilation and there is enough lightening. And make sure that you are comfortable so that you will not be bending. Then later you start complaining of back pain. I don't know why some people they don't like being comfortable. So you need to be comfortable and then your patient is also comfortable before you start the procedure. And then the cannula should be placed in the non-dominant arm. That means that if you are left-handed like me, you're going to place the cannula in my right hand, right? But if you are right-handed, you're going to place the cannula in the left hand. But it doesn't mean that if you don't find pain in the non-dominant hand, you keep searching and saying, no, I must use that one. Go to the dominant hand and search. And anyway, you feel you can find a suitable vein, just search it there. But first of all, check the non-dominant hand. Now, the procedure proper. First step, wash your hands and don your gloves. Draw 2 to 5 ml water for injection and set aside. Cut the plaster and also set aside. Apply a tourniquet and identify a suitable vein. Recheck the vein that's what identified. Ask your patient to close and open fists in order to distend vein. Clean around the sites with alcohol swab and allow to dry. Remove the cannula from packaging. Do not touch the needle as it is sterile. And remember, the place you clean, after cleaning, do not touch that area again because it's already clean. Hold the skin towel with the non-dominant hand in order to anchor vein. On the patient, sharp scratch, then proceed gently with the cannula. Hold the needle up and at 20 to 45-degree angle depending on the depth of the vein. Then pierce skin to reach and not penetrate vein. And look back for flashback of blood into the cannula. Withdraw the cannula needle slightly and look for backflow of blood into the cannula. If there is backflow of blood, slide the cannula into the vein in one quick motion. If backflow of blood is invisible, straighten the angle, advance the needle. Release the tourniquet and apply gentle pressure at the tip of the cannula. Remove the needle fully. Remove the cap of the needle and put it at the end of the cannula. Put the needle in the sharp beam, that's the safety box. Then secure the cannula with tape. A padded splint, which I told you about, can be put especially in children or infants. Flush through the cannula with the saline that you withdrew earlier. While you are flushing, if there's any resistance to pain, if there's any resistance like it can't go in or there is pain or there is swelling, stop flushing immediately. Remove the cannula and start again from the beginning. Dispose gloves and the equipment into the clinical waste bin if you were successful. Let the patient know that you are finished and thank the patient for their time. Ensure to document the procedure in the patient's file. Note the time, the date, the type of cannula used, the location, and any complication. Complications are cannula can tissue, which means that fluid can enter the subcutaneous tissue instead of the vein. Hematoma formation. There can be cellulitis and vein inflammation. Then the aftercare, you need to instruct the patient to inform the nurse on duty if they experience any of the following. 1. If the site become red, hot or swollen. The area around the cannula feels wet. Or if the tape have become loose. If the cannula is limiting self-care, disconnect immediately. Ideally, cannula should be flushed at least 3 times daily and should be removed after 72 hours. Since you know how to insert the cannula, you need to know the removal too. These are the steps that are taken. You release the tape, you withdraw the cannula, then you apply direct pressure with dry swab or gauze for at least 5 minutes. These are personal tips you can always have at the back of your mind whenever you are setting an IV cannula. One, avoid cannulating at the joints area because it can be very uncomfortable. Blood can be taken the first time you put the IV cannula. Remember to flush after connecting it to prevent blood clots. In general, IV cannulation can be a little tricky, but remember, hold the skin towel with your non-dominant hand. Involve seniors if the patient is difficult to cannulate. Guys, I told you that there was a special guest in this episode, right? Guess who the special guest is? No! So I'll be using her arm for this procedure. So be sure to say thank you because it's not easy. She's the most supportive ever, the most amazing. So you guys take her for me. My dear viewers, we have come to the end of this IV cannulation video. I hope you gained something from this video as usual. Please do not forget to like, share, and subscribe to my channel. If you know you are enjoying my video and you're not subscribing, why are you not subscribing? Is that not wickedness? Please subscribe. I'm begging. Subscribe to my channel, okay? In my next video, two topics in mind. One is stages of grief, and the other one is menstrual cycle. Stay tuned for more videos. Do not forget to like, share, subscribe, and give this video a thumbs up.